For those of us who don't know, what is pulsed electromagnetic field? And if you had to give like a short elevator pitch, how would you say that it works and what it does?
Sure. So that's a great question. I'll give you the very, very short answer that most people can relate to is PEMF therapy is induction of electricity into the cells to simulate healing. The key word there is induction. It is not like STIM or TENS or Newbie and NeuroFit where we have to have contacts on the body to put electricity. We're actually able to create electricity at a distance, similar to those inductive charging plates we have on our cell phones. Now we have the plate, we put the cell phone down there and we walk away. It's not plugged in, it's wireless power. So we're putting energy in the cell at a distance. How it works in a very simple fashion is a part of the injury or the healing process is that the electricity or the voltage in the cell is reduced from injury, from strain, from stress. This is like a big battery charger. The magnetic field passes through the loop into the cell. The cell retains a little bit of a charge each time. And when the cell is full of energy or healthy, it reads the DNA coding that's already programmed in the cell and says, wait a minute, I'm not postoperative knee scar tissue, I'm healthy tissue, and replicates a healthier version each time.
Okay. So the first time I tried this, it was pretty interesting. There are some parts of the body where I didn't feel anything at all, and then other parts of the body where I definitely felt it. Can you explain why that happens?
Sure. So that is what I refer to as our McDonald's Big Mac secret sauce. That is the uniqueness of the high power PEMF because you really only get it with that type of technology. And there's the reason we have two distinct sensations are very simple. Is typically wherever we have injury, the energy in those cells are reduced. It's like a cup that is reduced of water that's lost half its water. So when you put the applicator near a spot that's had injury, you feel it go right to the spot because that magnetic pulse, the energy is coming into the body and going directly to that spot. When you put it on an area where you don't have previous injury or pain, it's a different sensation. It's almost like a strong muscle contraction that's forcing the muscles to move. I always equate it to one of those nice weddings that have the champagne glass tower and the maitre d' fills up the top glass and it cascades down. And that's similar to our machine.
Okay. All right. And then what does it mean when you feel pulsating, like a pulsing sensation versus an aching sensation? Is there a difference between the two?
There is. So typically the aching sensation is the pulse is resonating to a spot or area that either is carrying damage or stress or injury, and it's sending the signal from the nerve to the brain telling us, hey, I've got a problem in my rotator, as an example. Typically when we're just feeling the pulsing or the jumping, it's not an injured site, so it's using the afferent nerve, it's going away from the brain and recreating that pulse signal. So while it's not intended to be a diagnostic, it certainly acts as one just based on those features right there.
Okay, all right. And then when we have people using the PEMF, there's a certain protocol, and the protocol starts with the coils in front of the chest, regardless of where the injury site is. Like the injury could be on the knee or the ankle, but it always starts, it seems like, on the chest. Can you explain that part of it?
Yes, it's a great question. The whole philosophy behind PEMF, how it is intended to work, and when you read all the literature about it, is it's systemically healing, right? It's the broken toe doesn't heal the broken toe. It's empowering the systems of the body to boost the immune system and accelerate the healing process. So how do you boost your immune system? Well, if we energize three main areas of the body, if we're doing the chest, we're really able to get the heart, the lungs, the thymus, a lot of the internal organs that essentially are doing the work. When we move fluid from the limbs in our feet, we treat our feet, but we also have to utilize or energize other areas of the body to complete that lymphatic drainage process. And that's essentially what we're doing, is empowering the systems of the body to go to work.
Okay. All right. And then does it matter if we're looking at this kind of more in how we use it for treatment? Does it matter if we use the PEMF before therapy versus after the therapy? How does it fit in with normal treatment for rehab?
So this is going to be, I'll give you a short answer, and I don't mean to talk out of both sides of my mouth, but I've seen so many with the athletes that it's hard not to, in that if ideally in an optimum situation, we do a little of both. Okay, if you've got athlete coming off of reconstructive knee surgery that's 6 months in, that's starting to go to work, ideally we would do a short session in the morning while they're warming up before they stretch when they first come in, let's say to the athletic training room or the physical therapy room. We have them go do their rehab, their work, and then we come back, and at the end of the day, we do the knee as well for rehab, for recovery, things like that. So on one end, it's performance enhancement. On the other end, it's recovery.
And then as far as therapy goes and the use of PEMF, are there any considerations to make in terms of timing or using it on the same day or whatnot for using PEMF with other treatment modalities? For example, like instrument-assisted soft tissue work, dry needling, cupping, iontophoresis, anything like that?
Awesome question. I have a doctor that specializes actually in Texas with our machine and iontophoresis. He does our machine first, and then he does the iontophoresis and gets a better result. Even though it's this big, bad, strong machine, it's a subtle energy device. And in my experience, most of the practitioners use it as the main adjunct to their therapy. They will do our machine first to stimulate the cells, to open up the cell gates, and then they will do dry needling. Then they'll do oxygen. Then they'll do massage. They'll do chiropractic adjustments. Typically, they'll do our machine first and utilize the other technologies right after. We have a guy up in the Bay Area that has a horse hyperbaric chamber for his horses, and that's exactly what he does. He does 20 minutes on the horse, and then he walks them into the oxygen chamber.
So it's kind of like priming the pump, essentially.
It's exactly what it is. Yes. Yeah. Yes.
Great.